Property and Casualty exam prep for real estate.
Question 1. A patient presents to the ED with a laceration requiring sutures. During the procedure, the patient states they feel faint. The nurse's first action is: Option A. Administer oxygen. Option B. Place the patient in Trendelenburg position. Option C. Immediately discontinue the procedure. Option D. Assess vital signs. The correct answer is option C. Immediately discontinue the procedure. The procedure should be stopped immediately to reduce vagal stimulation and prevent syncope. Then the patient can be placed supine and assessed. Question 2. The typical presentation of autonomic dysreflexia includes: Option A. Severe hypotension and bradycardia. Option B. Severe hypertension, pounding headache, and diaphoresis above the injury level. Option C. Fever and muscle spasms. Option D. Decreased level of consciousness. The correct answer is option B. Severe hypertension, pounding headache, and diaphoresis above the injury level. Autonomic dysreflexia causes severe hypertension, headache, flushing, and diaphoresis above the level of injury. Question 3. A narrow-complex, regular tachycardia at 180 bpm with no visible P waves is most likely. Option A. Atrial fibrillation. Option B. AV nodal reentrant tachycardia, right. Option C. Ventricular tachycardia. Option D. Atrial flutter.
The correct answer is option C, increases coverage.
Right is a common SVT with P waves often buried in the QRS. In this rotation, D is the correct position. Question 4. A patient with preeclampsia has which classic triad? Option A. Hypotension, bradycardia, hypothermia. Option B. Hypertension, proteinuria, edema. Option C. Fever, cough, rhinorrhea. Option D. Chest pain, diaphoresis, dyspnea. The correct answer is option D. Chest pain, diaphoresis, dyspnea. The classic triad of preeclampsia is hypertension, proteinuria, and edema. In this rotation, D is the correct position. Question 5. A patient with ethylene glycol, antifreeze, poisoning has: Option A. Normal anion gap acidosis. Option B. High anion gap metabolic acidosis with calcium oxalate crystals in urine. Option C. Respiratory alkalosis. Option D. Hypoglycemia. The correct answer is option C. Respiratory alkalosis. Ethylene glycol causes high anion gap acidosis, oxalate crystalluria, and end organ damage. In this rotation, C is the correct position. Question 6. A patient with a seizure disorder is being discharged. The nurse includes which important teaching point? Option A. You may drive immediately after starting medication. Option B. Take your medication consistently and avoid alcohol. Option C. Stop the medication if you feel better. Option D. Seizures are not dangerous, so treatment is optional. The correct answer is option A. You may drive immediately after starting medication. Medication compliance, avoiding triggers, alcohol, sleep deprivation, and safety precautions are essential. In this rotation, A is the correct position. Question 7. A pregnant patient at 32 weeks presents with vaginal bleeding and abdominal pain. The nurse's priority is: Option A. Pelvic examination. Option B. Assess fetal heart tones and maternal vital signs. Option C. Administer tocolytics. Option D. Discharge with follow-up. The correct answer is option B. Assess fetal heart tones and maternal vital signs. Fetal and maternal assessment are priorities. Pelvic exam may be deferred until placenta previa is ruled out. Question 8. The most common cause of fatal anaphylaxis is: Option A. Cutaneous symptoms. Option B. Airway obstruction from laryngeal edema and cardiovascular collapse. Option C, gastrointestinal symptoms. Option D, renal failure. The correct answer is option C, gastrointestinal symptoms. Airway compromise and shock are the primary causes of death in anaphylaxis. In this rotation, C is the correct position. Question 9. Which of the following is a common trigger for hepatic encephalopathy? Option A, regular bowel movements. Option B, hypokalemia. Option C, GI bleeding. Option D, adequate hydration. The correct answer is option A, regular bowel movements. GI bleeding, infection, hypokalemia, and constipation are common triggers for hepatic encephalopathy. In this rotation, A is the correct position. Question 10. The nurse is assessing for fluid responsiveness. A patient with a pulse pressure variation of 15% on controlled mechanical ventilation is likely. Option A, not fluid responsive. Option B, fluid responsive. Option C, in heart failure. Option D, hypervolemic.
The correct answer is option B. Any defendant can be held responsible for the entire judgment, regardless of their percentage of fault.
PPV 13% suggests the patient is fluid responsive and will increase cardiac output with fluids. In this rotation, C is the correct position. Question 11. A patient with chest trauma develops subcutaneous emphysema of the neck and chest. This finding strongly suggests Option A, myocardial contusion. Option B, tracheobronchial injury or pneumothorax. Option C, aortic injury. Option D, esophageal rupture. The correct answer is option B, tracheobronchial injury or pneumothorax. Subcutaneous emphysema indicates air escaping from the lung or airway into the tissues, commonly from pneumothorax or airway injury. Question 12. A patient with acute angle closure glaucoma presents with Option A, gradual vision loss. Option B, sudden severe eye pain, cloudy cornea, fixed mid-dilated pupil, and increased IOP. Option C, painless vision loss. Option D, bilateral eye discharge. The correct answer is option C, painless vision loss. Angle closure glaucoma causes sudden severe eye pain, cloudy cornea, and fixed mid-dilated pupil. In this rotation, C is the correct position. Question 13. A patient who is a Jehovah's Witness refuses blood transfusion despite life-threatening hemorrhage. The nurse should Option A, administer the transfusion anyway to save the patient's life. Option B, respect the patient's autonomous decision and continue alternative treatments. Option C, obtain a court order immediately. Option D, administer blood without telling the patient. The correct answer is option B, respect the patient's autonomous decision and continue alternative treatments. A competent adult has the right to refuse any treatment, even life-saving measures. The decision must be respected. Question 14. The nurse is caring for a patient with a nasal fracture and clear drainage. The drainage tests positive for glucose. This indicates Option A, allergic rhinitis. Option B, CSF rhinorrhea. Option C, normal nasal secretions. Option D, sinusitis.
The correct answer is option A, actual coverage to the certificate holder.
CSF contains glucose, normal nasal secretions do not. In this rotation, D is the correct position. Question 15. The drug of choice for managing hypertension in a patient with a pheochromocytoma is Option A, beta blockers alone. Option B, phenoxybenzamine, alpha blocker. Option C, ACE inhibitors. Option D, diuretics.
The correct answer is option D, condominiums.
Alpha blockade with phenoxybenzamine or phentolamine is the primary treatment. In this rotation, A is the correct position. Question 16. The primary treatment for symptomatic hypocalcemia is Option A, oral calcium supplements. Option B 4-calcium gluconate or calcium chloride. Option C vitamin D only. Option D magnesium sulfate. The correct answer is option B 4-calcium gluconate or calcium chloride. Symptomatic hypocalcemia, tetany, cardiac effects, requires immediate 4-calcium replacement. Question 17. Which of the following is a classic sign of a massive pulmonary embolism on ECG? Option A ST segment elevation in 2, 3, AVF. Option B S1Q3T3 pattern and right axis deviation. Option C diffuse ST elevation. Option D prolonged PR interval. The correct answer is option C. Diffuse ST elevation. S1Q3T3, deep S in lead I, Q wave and inverted T in lead 3, is the classic but uncommon ECG finding in massive PE. In this rotation, C is the correct position. Question 18. A patient with hyperparathyroidism typically has which lab findings? Option A low calcium and high phosphate. Option B high calcium and low phosphate. Option C low calcium and low phosphate. Option D normal calcium and phosphate. The correct answer is option C. Low calcium and low phosphate. Hyperparathyroidism causes hypercalcemia and hypophosphatemia. In this rotation, C is the correct position. Question 19. A patient with known CAD has chest pain relieved by leaning forward and worsened by lying supine. The nurse suspects. Option A unstable angina. Option B acute pericarditis. Option C pulmonary embolism. Option D esophageal spasm. The correct answer is option B. Acute pericarditis. Pericarditis produces pleuritic, positional chest pain relieved by sitting up and leaning forward. Question 20. The tensilin, edrophonium, test is used to diagnose. Option A multiple sclerosis. Option B myasthenia gravis. Option C Guillain-Barré syndrome. Option D Parkinson's disease. The correct answer is option D. Parkinson's disease. The tensilin test involves administering edrophonium, which temporarily improves muscle strength in mg. In this rotation, D is the correct position. Question 21. A patient receiving thrombolytic therapy develops angioedema. The nurse should: Option A continue the infusion. Option B stop the infusion and manage the airway. Option C administer more thrombolytics. Option D administer antihypertensives. The correct answer is option C. Administer more thrombolytics. Angioedema is a serious allergic reaction. The infusion should be stopped and airway management prioritized. In this rotation, C is the correct position. Question 22. The initial treatment for a patient with acute esophageal variceal bleeding includes: Option A immediate surgery. Option B endoscopic variceal ligation or sclerotherapy. Option C observation only. Option D oral proton pump inhibitors. The correct answer is option D. Oral proton pump inhibitors. Endoscopic therapy is the definitive treatment for active variceal bleeding. In this rotation, D is the correct position. Question 23. A patient leaving against medical advice, AMA, must be informed of: Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving without completing treatment. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving without completing treatment. A patient with decision-making capacity has the right to refuse treatment. The nurse's duty is to inform of risks and document thoroughly. Question 24. A patient with heart failure has a BNP level of 2500 pg/ml. This result indicates Option A, heart failure is unlikely. Option B, dyspnea is likely pulmonary in origin. Option C, heart failure is highly likely. Option D, acute myocardial infarction. The correct answer is option C. Heart failure is highly likely. BNP levels above 400 to 500 pg/ml are highly suggestive of heart failure. Question 25. A patient with anaphylaxis has received epinephrine and antihistamines but has persistent wheezing. The next intervention is Option A. More epinephrine. Option B, albuterol nebulizer. Option C, intubation. Option D, observation. The correct answer is option B. Albuterol nebulizer. Albuterol treats bronchospasm. Epinephrine is systemic, albuterol provides local bronchodilation. Question 26. A patient's systolic BP drops 15 mmHg during inspiration. This finding is Option A, pulsus alternans. Option B, pulsus paradoxus. Option C, pulsus bisferens. Option D, orthostatic hypotension. The correct answer is option B. Pulsus paradoxus. Pulsus paradoxus is an inspiratory fall in systolic BP greater than 10 mmHg. Question 27. A patient with a traumatic amputation of a finger arrives in the ED. The amputated part should be Option A, placed directly on ice. Option B, wrapped in moist gauze, placed in a sealed bag, and placed on ice, not directly. Option C, placed in warm water. Option D, discarded. The correct answer is option C. Placed in warm water. The part should be kept cool but not frozen. Direct ice contact causes tissue damage. In this rotation, C is the correct position. Question 28. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea.
The correct answer is option B, vehicles listed on the declarations, newly acquired autos, and temporary substitute vehicles.
Hypotension is a late and ominous sign of shock, especially in young, healthy patients who can compensate until significant blood loss. Question 29. A patient with a known seizure disorder has been seizing for 6 minutes without regaining consciousness. This is termed Option A, cluster seizures. Option B, status epilepticus. Option C, complex partial seizure. Option D, absence seizure. The correct answer is option B. Status epilepticus. Status epilepticus is defined as a seizure lasting more than 5 minutes or recurrent seizures without return to baseline. Question 30. The appropriate initial management for a patient with an acute COPD exacerbation includes Option A, high-flow oxygen, bronchodilators, and systemic corticosteroids. Option B, immediate intubation. Option C, antibiotics only. Option D, chest physiotherapy as the primary treatment. The correct answer is option C. Antibiotics only. Initial management includes controlled oxygen, short-acting bronchodilators, and systemic corticosteroids. In this rotation, C is the correct position. Question 31. The purpose of measuring lactate clearance in sepsis is to Option A, diagnose infection. Option B, assess the adequacy of resuscitation and tissue perfusion. Option C, determine the need for antibiotics. Option D, monitor renal function. The correct answer is option C. Determine the need for antibiotics. Decreasing lactate levels, clearance, indicate improving tissue perfusion and effective resuscitation. In this rotation, C is the correct position. Question 32. A patient with acute epididymitis presents with Option A, painless testicular swelling. Option B, gradual onset of scrotal pain, swelling, and tenderness, often with fever. Option C, sudden severe testicular pain with nausea. Option D, scrotal mass only. The correct answer is option C. Sudden severe testicular pain with nausea. Epididymitis has gradual onset with tenderness, swelling, and often infectious symptoms. In this rotation, C is the correct position. Question 33. A patient with rhabdomyolysis is at highest risk for developing Option A, liver failure. Option B, cardiac dysrhythmia. Option C, acute kidney injury from myoglobinuria. Option D, pulmonary edema. The correct answer is option C. Acute kidney injury from myoglobinuria. Myoglobin released from damaged muscle precipitates in renal tubules, causing acute kidney injury. Question 34. A patient with a suspected ectopic pregnancy and hemodynamic instability should be Option A, observed in the ED. Option B, prepared for immediate surgical intervention. Option C, sent home with follow-up. Option D, treated with methotrexate. The correct answer is option D. Treated with methotrexate. Hemodynamic instability indicates rupture, requiring emergency surgery. In this rotation, D is the correct position. Question 35. The most common cause of anaphylaxis in the emergency department is Option A, insect stings. Option B, medications, antibiotics, NSAIDs. Option C, food allergies. Option D, latex.
The correct answer is option C, reduces coverage.
Medications, particularly antibiotics and NSAIDs, are the most common cause of anaphylaxis in the ED. In this rotation, C is the correct position. Question 36. Which additional antiplatelet agent is most commonly given with aspirin for ACS? Option A, warfarin. Option B, clopidogrel or ticagrelor. Option C, alteplase. Option D, digoxin.
The correct answer is option A, covers all pollution losses.
Dual antiplatelet therapy with aspirin plus a P2Y12 inhibitor is standard. In this rotation, A is the correct position. Question 37. A patient presents with sudden unilateral hearing loss and vertigo. The nurse suspects Option A, Meniere's disease. Option B, acoustic neuroma. Option C, labyrinthitis. Option D, benign paroxysmal positional vertigo.
The correct answer is option D, attorney fees for the insured's personal attorney.
Sudden unilateral hearing loss with vertigo may indicate an acoustic neuroma or labyrinthitis. Question 38. The most sensitive indicator of impending respiratory failure in a patient with myasthenia gravis is Option A, decreasing vital capacity and negative inspiratory force. Option B, increasing heart rate. Option C, decreasing oxygen saturation. Option D, increasing respiratory rate. The correct answer is option A. Decreasing vital capacity and negative inspiratory force. Serial measurements of vital capacity and NIF are the best indicators of respiratory muscle weakness and impending failure in MG. Question 39. A patient presents with SLUDGEM symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, and meiosis. This toxidrome is caused by Option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids.
The correct answer is option B, increases the vacancy period from 60 days with reduced coverage.
The SLUDGEM presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. In this rotation, D is the correct position. Question 40. A patient has a Glasgow Coma Scale score of 7. The priority intervention is Option A, neurological reassessment in 15 minutes. Option B, pain medication administration. Option C, intravenous fluids only. Option D, immediate endotracheal intubation for airway protection. The correct answer is option A. Neurological reassessment in 15 minutes. GCS of 8 or less indicates severe brain injury and inability to protect the airway, requiring intubation. In this rotation, A is the correct position. Question 41. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option C. Irritable bowel syndrome. The classic presentation of small bowel obstruction includes cramping pain, distension, vomiting, and early high-pitched bowel sounds. In this rotation, C is the correct position. Question 42. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option C. Nephrolithiasis. Pyelonephritis presents with systemic symptoms, fever, chills, and CVA tenderness. In this rotation, C is the correct position. Question 43. Murphy's sign is used to assess for Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B. Acute cholecystitis. Murphy's sign, pain and inspiratory arrest during palpation of the right upper quadrant, suggests acute cholecystitis. Question 44. The most common cause of upper GI bleeding is Option A, esophageal varices. Option B, peptic ulcer disease. Option C, Mallory-Weiss tear. Option D, gastric cancer.
The correct answer is option D, authority granted by the insured.
Peptic ulcer disease is the most common cause of upper GI bleeding. In this rotation, D is the correct position. Question 45. Which of the following patients is at highest risk for developing DKA? Option A type 2 diabetic with good control. Option B. A type 1 diabetic with an infection who missed insulin doses. Option C. A non-diabetic patient. Option D. A patient with well-managed diabetes. The correct answer is option D. A patient with well-managed diabetes. Type 1 diabetics who miss insulin and have an infection are at highest risk for DKA. In this rotation, D is the correct position. Question 46. A patient with a pulmonary contusion is at highest risk for developing Option A, pneumothorax. Option B, acute respiratory distress syndrome, ARDS. Option C, pneumonia. Option D, pleural effusion. The correct answer is option B. Acute respiratory distress syndrome, ARDS. Pulmonary contusion causes inflammation and capillary leak, which can progress to ARDS over 24 to 48 hours. Question 47. A patient with chest pain has ST depression in leads V5, V6 and lead I. This suggests Option A, inferior ischemia. Option B, anterior ischemia. Option C, lateral ischemia. Option D, septal ischemia.
The correct answer is option A, the damaged portion only.
ST changes in V5, V6, and lead I reflect the lateral wall of the left ventricle. Question 48. A patient with a severe headache and nuchal rigidity has a CT scan that is negative for blood. The next step is Option A, discharge the patient home. Option B, administer pain medication only. Option C. Perform a lumbar puncture to rule out subarachnoid hemorrhage. Option D. Order an MRI.
The correct answer is option A, writing any business.
CT may miss small SAH. Lumbar puncture is necessary to detect xanthochromia if clinical suspicion remains high. In this rotation, D is the correct position. Question 49. Which potassium level is most concerning and requires immediate intervention? Option A 3.5 milliequivalent/L. Option B 6.8 milliequivalent/L with ECG changes. Option C 4.0 milliequivalent/L. Option D 5.0 milliequivalent/L. The correct answer is option A. 3.5 milliequivalent/L. Severe hyperkalemia with ECG changes is a life-threatening emergency requiring immediate treatment. In this rotation, A is the correct position. Question 50. A patient with DKA is being treated with 4 fluids and insulin. The nurse must carefully monitor. Option A. Liver function tests. Option B. Serum potassium levels. Option C. Coagulation studies. Option D. Cardiac enzymes. The correct answer is option C. Coagulation studies. Potassium shifts during DKA treatment can cause life-threatening hypokalemia or hyperkalemia. In this rotation, C is the correct position. Question 51. A patient with cirrhosis and ascites develops spontaneous bacterial peritonitis. The hallmark sign is: Option A. Painless abdominal distension. Option B. Abdominal pain with rebound tenderness and fever. Option C. Visible peristalsis. Option D. Borborygmi. The correct answer is option C. Visible peristalsis. SBP presents with abdominal pain, fever, and peritoneal signs in a patient with ascites. In this rotation, C is the correct position. Question 52. The nurse is caring for a patient on a cardiac monitor who develops ventricular fibrillation. The nurse should first: Option A. Administer epinephrine. Option B. Begin CPR and prepare for defibrillation. Option C. Administer amiodarone. Option D. Obtain a 12-lead ECG. The correct answer is option A. Administer epinephrine. Immediate CPR and defibrillation are the priorities for pulseless VF/VT. In this rotation, A is the correct position. Question 53. A patient with a kidney transplant presents with fever and graft tenderness. The nurse suspects: Option A. Routine post-operative pain. Option B. Urinary tract infection. Option C. Acute rejection. Option D. Muscle strain. The correct answer is option A. Routine post-operative pain. Fever and graft tenderness in a transplant patient suggest acute rejection. In this rotation, A is the correct position. Question 54. A patient develops sepsis with a temperature of 38.8 degrees Celsius, heart rate 110, respiratory rate 24, and WBC 16,000. These findings meet criteria for: Option A. Sepsis only. Option B. Severe sepsis, sepsis with organ dysfunction. Option C. SIRS, meets all 4 criteria. Option D. Septic shock.
The correct answer is option A, unlimited.
The patient meets all 4 SIRS criteria: temp, HR, RR, WBC. With suspected infection, this is sepsis. In this rotation, D is the correct position. Question 55. A patient with a stroke has a blood pressure of 210/120 mmHg. The nurse should anticipate: Option A. Immediate aggressive lowering to 120/80. Option B. Permissive hypertension unless receiving thrombolytics. Option C. No treatment needed for blood pressure. Option D. Administration of 4 fluids only. The correct answer is option A. Immediate aggressive lowering to 120/80. Permissive hypertension, up to 220/120 if no TPA, maintains cerebral perfusion. Aggressive lowering can worsen ischemia. In this rotation, A is the correct position. Question 56. A patient with known heart failure presents with dyspnea, bilateral crackles, and an S3 gallop. The nurse recognizes these findings as consistent with Option A, acute pericarditis. Option B, acute decompensated heart failure with pulmonary edema. Option C, pulmonary embolism. Option D, COPD exacerbation. The correct answer is option B. Acute decompensated heart failure with pulmonary edema. The constellation of dyspnea, crackles, and S3 is classic for acute decompensated heart failure. Question 57. Testicular torsion is a surgical emergency requiring intervention within Option A, 24 hours. Option B, 4 to 6 hours. Option C, 2 to 3 days. Option D. It is not a surgical emergency.
The correct answer is option A, the warehouse building.
Testicular salvage rates are highest when detorsion occurs within 4 to 6 hours of symptom onset. Question 58. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option D. Subcutaneous emphysema. Flail chest presents with paradoxical chest wall movement. In this rotation, D is the correct position. Question 59. The most common cause of autonomic dysreflexia is Option A, pain. Option B, bladder distension. Option C, anxiety. Option D, fever.
The correct answer is option B, has contents but no people.
Bladder distension, from blocked catheter, is the most common trigger for autonomic dysreflexia. Question 60. A patient receiving 4-nitroglycerin for chest pain develops a severe headache. The nurse should Option A, stop the nitroglycerin immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option D. Switch to oral nitrates. Headache is a common side effect of nitrates. Analgesics can be given while continuing therapy. In this rotation, D is the correct position. Question 61. A patient presents with sudden dyspnea and sharp chest pain while traveling on a long flight. The initial diagnostic test should be Option A, chest X-ray. Option B, ECG and D-dimer. Option C, CT pulmonary angiography. Option D, V/Q scan. The correct answer is option D. V/Q scan. Initial evaluation includes clinical assessment, ECG, and D-dimer. CT pulmonary angiography is the definitive test. In this rotation, D is the correct position. Question 62. The nurse anticipates which loading dose in addition to aspirin for STEMI going to PCI? Option A, warfarin 5 mg. Option B, ticagrelor 180 mg or clopidogrel 600 mg. Option C, heparin 5000 units. Option D, alteplase bolus. The correct answer is option B. Ticagrelor 180 mg or clopidogrel 600 mg. A P2Y12 inhibitor loading dose along with aspirin is standard dual antiplatelet therapy for PCI. Question 63. A patient with thyroid storm presents with which findings? Option A, hypothermia and bradycardia. Option B, hyperthermia, tachycardia, and altered mental status. Option C, hypotension and hypothermia. Option D, weight gain and lethargy. The correct answer is option D. Weight gain and lethargy. Thyroid storm is life-threatening hyperthyroidism with hyperthermia, tachycardia, and CNS dysfunction. In this rotation, D is the correct position. Question 64. SIRS, Systemic Inflammatory Response Syndrome, criteria include all of the following except Option A, heart rate greater than 90 bpm. Option B, respiratory rate greater than 20 or PaCO2 32 mmHg. Option C, temperature 38 degrees C or 36 degrees Celsius. Option D, elevated troponin.
The correct answer is option D, non-owned autos.
SIRS criteria include temperature, heart rate, respiratory rate, and WBC count abnormalities. Elevated troponin is not a SIRS criterion. Question 65. A patient with inhalation injury from a fire has singed nasal hairs, carbonaceous sputum, and hoarseness. The priority intervention is Option A, obtain a chest X-ray. Option B, early elective endotracheal intubation. Option C, administer antibiotics. Option D, apply cool mist oxygen. The correct answer is option B, early elective endotracheal intubation. Signs of airway thermal injury require early intubation before edema progresses and makes intubation difficult or impossible. Question 66. The correct initial energy setting for biphasic synchronized cardioversion of unstable atrial flutter is Option A, 50 to 100 J. Option B, 120 to 200 J. Option C, 300 J. Option D, 360 J. The correct answer is option D, 360 J. Atrial flutter typically requires lower energy for cardioversion. In this rotation, D is the correct position. Question 67. A patient with a hyphema should be positioned. Option A, flat with the affected eye down. Option B, with the head of bed elevated 30 to 45 degrees. Option C, prone. Option D, in Trendelenburg. The correct answer is option B, with the head of bed elevated 30 to 45 degrees. Head elevation helps settle blood in the anterior chamber and reduce rebleeding risk. Question 68. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from Option A, peptic ulcer disease. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option D, aortoenteric fistula. The Sengstaken-Blakemore tube provides balloon tamponade of bleeding esophageal or gastric varices. In this rotation, D is the correct position. Question 69. A patient with a burn injury has singed nasal hairs and carbonaceous sputum. The nurse anticipates Option A, outpatient management. Option B, early endotracheal intubation due to airway edema risk. Option C, antibiotics only. Option D, immediate debridement.
The correct answer is option A, always excluded.
Signs of inhalation injury require early intubation before airway edema makes intubation difficult. In this rotation, D is the correct position. Question 70. The classic triad of symptoms for acute appendicitis is Option A, fever, vomiting, diarrhea. Option B, periumbilical pain migrating to RLQ, anorexia, nausea/vomiting. Option C, jaundice, dark urine, clay-colored stools. Option D, hematemesis, melena, hypotension. The correct answer is option A, fever, vomiting, diarrhea. The classic presentation is periumbilical pain that migrates to the RLQ with anorexia and nausea. In this rotation, A is the correct position. Question 71. A patient with acute adrenal insufficiency, Addisonian crisis, requires Option A, insulin. Option B, immediate corticosteroid replacement. Option C, thyroid hormone. Option D, antibiotics only. The correct answer is option C. Thyroid hormone. Addisonian crisis is life-threatening and requires immediate 4 corticosteroids, hydrocortisone. In this rotation, C is the correct position. Question 72. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is option A. Encourage early ambulation. Initial management includes bowel rest, NPO, and aggressive 4-fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. In this rotation, A is the correct position. Question 73. A patient with acute urinary retention develops post-obstructive diuresis after catheterization. The nurse should monitor for Option A. Hypertension. Option B. Hyperkalemia. Option C. Hypotension and electrolyte imbalances. Option D. Respiratory depression. The correct answer is option C. Hypotension and electrolyte imbalances. Post-obstructive diuresis can cause massive fluid loss leading to hypotension and electrolyte disturbances. Question 74. A patient with myasthenia gravis presents with ptosis, diplopia, and progressive weakness. These symptoms are due to Option A. Demyelination of central nerves. Option B. Destruction of dopamine-producing neurons. Option C. Antibodies against acetylcholine receptors at the neuromuscular junction. Option D. Compression of the spinal cord. The correct answer is option C. Antibodies against acetylcholine receptors at the neuromuscular junction. MG is an autoimmune disorder where antibodies block or destroy acetylcholine receptors, impairing neuromuscular transmission. Question 75. The treatment for malignant hyperthermia is Option A. Dantrolene sodium. Option B. Calcium gluconate. Option C. Sodium bicarbonate. Option D. Naloxone. The correct answer is option A. Dantrolene sodium. Dantrolene inhibits calcium release from the sarcoplasmic reticulum, reversing the hypermetabolic state. Question 76. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. Unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. Constricted, sluggishly reactive pupils. The correct answer is option B. Unilaterally dilated and fixed pupil. Uncal herniation compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed pupil. Question 77. A patient with cardiac tamponade will have which echocardiographic finding? Option A. Left ventricular hypertrophy. Option B. Right ventricular diastolic collapse. Option C. Aortic stenosis. Option D. Mitral valve prolapse. The correct answer is option D. Mitral valve prolapse. RV diastolic collapse is a specific sign of tamponade. In this rotation, D is the correct position. Question 78. A patient develops chest pain and hypotension 3 days post-ME with a new holosystolic murmur at the LSB. The nurse suspects Option A. Ventricular septal rupture. Option B. Acute mitral regurgitation. Option C. Pericarditis. Option D. Pulmonary embolism. The correct answer is option A. Ventricular septal rupture. A new loud holosystolic murmur at the LSB post-ME suggests ventricular septal rupture. Question 79. The initial fluid resuscitation for a patient in septic shock per surviving sepsis guidelines is Option A. 250 ml of 0.9% normal saline. Option B. 500 ml of D5W. Option C. At least 30 ml/kg of isotonic crystalloid. Option D. Packed red blood cells to hemoglobin of 10 g/dl. The correct answer is option B. 500 ml of D5W. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid. In this rotation, B is the correct position. Question 80. The definitive treatment for acute cholecystitis is: Option A. Antibiotics alone. Option B. Observation only. Option C. Cholecystectomy. Option D. Endoscopic sphincterotomy. The correct answer is option D. Endoscopic sphincterotomy. Cholecystectomy is the definitive treatment for acute cholecystitis. In this rotation, D is the correct position. Question 81. Which of the following is a sign of magnesium toxicity? Option A. Hyperreflexia and tachycardia. Option B. Loss of deep tendon reflexes, respiratory depression, and hypotension. Option C. Seizures. Option D. Hypertension.
The correct answer is option B, upset of the vehicle or impact with another object. Collision covers rollover or impact with another vehicle or object. Question 82. Under the standard mortgage clause, the mortgagee, option A, has no rights under the policy. Option B, receives loss payment even if the insured violated policy conditions. Option C, must pay the premium. Option D, cannot file a claim. The correct answer is option A, has no rights under the policy. The mortgagee's interest is protected even if the insured's actions would void coverage. In this rotation, A is correct. Question 83. The household exclusion in some PAPs excludes liability coverage for: Option A, injuries to pedestrians. Option B, bodily injury to family members residing in the same household. Option C, damage to other vehicles. Option D, injuries to passengers. The correct answer is option B, bodily injury to family members residing in the same household. Some states allow an exclusion for injuries to resident family members to prevent collusive claims. Question 84. A public adjuster represents: Option A, the insurer. Option B, the insured in negotiating a claim settlement. Option C, the state. Option D, both parties equally. The correct answer is option D, both parties equally. Public adjusters advocate for the policyholder, not the insurer. In this rotation, D is correct. Question 85. The PAP's duties after an accident require the insured to: Option A, admit fault immediately. Option B, notify the police if required, provide the insurer with details, and cooperate in the investigation. Option C, pay all damages upfront. Option D, repair the vehicle before inspection. The correct answer is option A, admit fault immediately. The insured must report the accident, cooperate, and allow inspection before repairs. In this rotation, A is correct. Question 86. Misrepresentation in insurance occurs when: Option A, all facts are truthfully disclosed. Option B, a false statement is made that affects the insurer's decision. Option C, the insurer denies a claim. Option D, the policy is renewed automatically. The correct answer is option D, the policy is renewed automatically. Misrepresentation is a false statement that, if material, can void the policy. In this rotation, D is correct. Question 87. Garagekeeper's legal liability can be written on a: Option A, direct primary, direct excess, or legal liability basis. Option B, only primary basis. Option C, only excess basis. Option D, only no-fault basis. The correct answer is option B, only primary basis. Garagekeepers offers three options: direct primary, direct excess, and legal liability. Question 88. A reciprocal insurance exchanges: Option A, a stock insurance company. Option B, an unincorporated group of subscribers who exchange insurance risks. Option C, a government insurance program. Option D, a type of health insurance. The correct answer is option D, a type of health insurance. Reciprocal exchanges are unincorporated associations where members, subscribers, insure each other. In this rotation, D is correct. Question 89. The statute of limitations for filing a property insurance lawsuit is typically: Option A, 6 months. Option B, 1 to 2 years from the date of loss. Option C, 5 years. Option D, 10 years. The correct answer is option D, 10 years. The time limit varies by state but is typically 1 to 2 years as stated in the policy. In this rotation, D is correct. Question 90. an inland marine policy covers. Option A, ocean-going vessels only. Option B, property in transit over land and certain movable property. Option C, real estate. Option D, automobiles. The correct answer is option C, real estate. Inland marine insurance covers property that moves or is transportable, such as cargo, fine arts, and equipment. In this rotation, C is correct. Question 91. A stock insurance company is owned by, option A, policyholders, option B, stockholders, option C, the government, option D, its employees. The correct answer is option B, stockholders. Stock companies are owned by shareholders who expect to earn a profit. Question 92. The exclusive remedy doctrine in workers' compensation means, option A, the employee can sue the employer for additional damages. Option B, workers' compensation benefits are the employee's exclusive remedy against the employer for work injuries. Option C, the employer has no liability. Option D, the employee must pay for their own medical care. The correct answer is option A, the employee can sue the employer for additional damages. In exchange for guaranteed benefits, employees generally give up the right to sue their employer. In this rotation, A is correct. Question 93. The CGL policies who is an insured provision includes, option A, only the named insured, option B, the named insured, employees, and certain other persons and organizations, option C, anyone who is injured, option D, only corporations. The correct answer is option D, only corporations. Insureds include the named insured, employees, for acts within scope, and certain additional insureds. In this rotation, D is correct. Question 94. Under contributory negligence, if a plaintiff is even 1% at fault, option A, they recover reduced damages, option B, they recover nothing, option C, they recover full damages, option D, the defendant is always liable. The correct answer is option B, they recover nothing. Contributory negligence is a complete bar to recovery. Any fault by the plaintiff prevents recovery. Question 95. A personal auto policy typically excludes coverage for, option A, personal use, option B, livery use, transporting people for hire, unless specifically endorsed, option C, commuting to work, option D, running errands. The correct answer is option A, personal use. Using a personal vehicle for hire, taxi, rideshare without proper endorsement, is excluded. In this rotation, A is correct. Question 96. Endorsements to a property policy. Option A, cannot change the policy. Option B, add, delete, or modify coverage in the policy. Option C, are always optional. Option D, never affect the premium. The correct answer is option D, never affect the premium. Endorsements, or riders, modify the standard policy form to meet the insured's specific needs. In this rotation, D is correct. Question 97. The period of restoration in a business income policy begins. Option A, when the policy is purchased. Option B, when the physical loss occurs. Option C, 72 hours after the physical loss. Option D, when the business reopens. The correct answer is option C, 72 hours after the physical loss. The period of restoration typically begins 72 hours after the physical loss occurs, unless a waiting period is eliminated. In this rotation, C is correct. Question 98. An electronic data processing (EDP) policy covers, option A, only the building, option B, computer equipment, data, and media, option C, only hardware, option D, only software. The correct answer is option B, computer equipment, data, and media. EDP policies cover computer hardware, software, data, and extra expenses related to computer system disruption. Question 99. The war exclusion in a commercial auto policy excludes, option A, all accidents, option B, losses caused by war, insurrection, or rebellion, option C, only declared wars, option D, only foreign wars. The correct answer is option C, only declared wars. War and similar actions are standard exclusions in most insurance policies. In this rotation, C is correct. Question 100. The standard mortgage clause provides more protection than a loss payable clause because, option A, the mortgagee has fewer rights, option B, the mortgagee's coverage is not voided by the insured's acts, option C, the mortgagee pays the premium, option D, the mortgagee is the insured. The correct answer is option B, the mortgagee's coverage is not voided by the insured's acts. The standard mortgage clause protects the mortgagee's interest even if the insured violates policy conditions.